today we have a friend from Rwanda, and yeah, we are talking about the politics before varicocele, and yeah, this is good. Rwanda, we know Rwanda is in the middle of, like in the heart of Africa, right?
True,
In the middle of
the heart
Africa.
of Africa.
Really? You call it heart of Africa?
Yeah.
Yeah. It's like a little in the left side,
Yeah.
just in the heart.
Yeah.
Place. Yeah. Okay. It's really true, and yeah, I hope the future will be good for all of us, all of the developing countries.
Yes.
I hope we'll have better days. And nowadays there is war in Israel, between Israel and Palestine, and we hope it will finish soon, and all the people has the right to live and normally and have equal rights. Okay, so please tell me how you find us from Rwanda. You live in Rwanda, right?
I live in Rwanda.
How do you find us from internet?
I find you guys from the internet, from YouTube.
Okay.
But mostly I found you from I can see on Google.
Okay.
Because you are like a specialist in Turkey for varicocele. And then thanks to my fiance.
Yes.
And then we saw the...
Last time she was your girlfriend, now fiance.
Now fiance. Nice.
You proposed, right?
Yeah.
Nice, very good.
So, and then through her, and then we did some research with the comment, reviews, because you had very good reviews.
Yeah.
So, and then I met your colleague,
yeah,
your assistant, and then we tried to be in touch. I was like...
is it difficult to keep in touch, to reach us, to what shall we...
It was very fast.
Okay.
Because I got the number, I started the number. The number was on WhatsApp.
Yeah.
Directly was like, come tomorrow.
Yeah. Okay.
So it was really fast.
Yeah, so we are trying to be as quick as possible, because people sometimes they say, oh, they will never answer, send a message, but my friend Musa and the team is really working on it.
Yeah.
And it's if they need me, the people need to talk to me, we arrange an online consultation.
Yeah. Yeah.
For example, for you didn't need me. I just met you in the clinic.
Yeah.
But before you talk with the guys, and sometimes people want to ask questions.
Yeah.
Sometimes they wonder, is it needed? The operation is needed, or they have surgery before, and they have to they want my comment.
Yeah.
So in that case, it's not easy to answer them with messages. Because I give a message, they don't see it. Then they give an answer 1 hour later. I don't see it. I give an answer next day. And it all mixed up. And if we are talking with 3-4 people, all of them mix up. So online consultation is good option. I spare my time from my schedule. At that hour, I don't take patients, just online consultation, and try to keep it cheap.
Yeah.
So this is good. And yours was right-sided varicocele, very different. How did you notice that you have it?
So in 2020, back home, I went to do the test. And then the doctor back home, he told me it was varicocele. But he gave me a proposal of doing embolization.
Okay.
So before I didn't know the difference between embolization and surgery. So I was like, maybe let me wait, this pain will just go by itself. But later, I was like, when I was here with my fiance and I keep the pain, I was like, I'm tired of this pain. So it's been 3 years with the pain.
With the pain, it's too much.
It's too much. It was on the right side.
Yes, actually, I noticed that usually the pain comes from the external veins, and the sperm decrease comes from the internal veins. How was your sperm count?
My sperm count, I would say, was getting lower. It was getting lower with age. Because I could see, let's say in 2020, and today was really...
There's a difference, but still under it is above the lower limit.
So the last time I did the check in 2020 was okay.
Yes.
But now I don't know, because we didn't do that. But from my eyes, I could see there's a decrease.
Difference in the volume of the quality of the sperm. Okay, so embolization is, every time I say 70% is a perfect solution, but 70%. In 30% of the cases, if there are external veins and the gubernacular veins, it's not working, so it has recurrence. Sometimes people choose to do it first for the 70% chance. If they fail, they come. It's also an option, because it is easier than operation. We operated you 2 days before.
Yes.
How was the operation? Was it very difficult? How was the pain after the operation?
The operation was fast, 40 minutes. 40 minutes, and to be honest, I didn't feel any pain.
How was first night?
The first night was okay. Really, the first night was okay. Of course, you feel some pain, but you take the painkillers.
We give you spinal anesthesia. I like it because it gives you 3 hours more without pain. And then after 3 hours, when the pain starts, the first couple of hours is very difficult. So we pass this part, we bypass this part, and then the painkillers is enough. But we are also doing it with general anesthesia too. In general anesthesia, when the patient wake up, he feels the pain immediately. We do some local anesthesia to that part to decrease the pain. Sometimes it works very nice, sometimes they feel quite a little pain. And then the first night you stay at the hospital, and second day you are discharged. You went to your hotel. Is it difficult? The hotel, how was it? The pain? We give a prescription.
So at the hotel, it was. I could still feel more the pain than in the hospital. Because I could feel my testicles very hot.
And you walked to the taxi and to the hotel.
So the pain was getting there, but thanks to the painkillers, I could feel much better. And today, to be honest, I feel much better.
Okay. Your hotel is very close. Did you come on walking or take a taxi?
I took a taxi.
It's better, of course, but it's in walking distance. So it's good to be close to hospital, to office. We are like a triangle, all of them close together. And other than that, now you said to me, you want to go back at the second day or third day. I said, okay, maybe, but now you say, let's delay the flight for 2-3 days more. So how many days you recommend to people after the procedure to stay here in Istanbul?
I would say 1 week. For me, 1 week, I think it's
more safe.
It's more safe to be like, can I now travel or let me stay with? But 1 week, I think.
Especially if there is no direct flight. So you have to make an.
Because now I will go to Cairo.
From Cairo.
If I was supposed to travel to today, I would spend 12 hours in the transit. That's a lot. And then I take a flight again for 5 hours and a half back home. So I was like, no, that's not a good idea.
It's better if you will have a long flight, a transit flight. Let's wait a little more and spend here 1 week. Spare here 1 week. Actually, for me, I call the patients for 6 days. I say 6 days. Usually it is enough, but if it's a long distance, this is better. Okay, so are you satisfied with the procedure, with our service? What's your comment?
I'm really satisfied. I'm really, because I'm 30 years old. I would say I'm young, and most of the people have to do the checkup, and when they feel the pain, please visit the doctor, especially my doctor.
Actually, is it necessary? Really, previously when people asked to me, I need a varicocele operation, do I have to come? I said, no. Try it in your country with a microscope, it is okay. Or it's microscopic surgery. Nowadays, I improved many techniques, and if it is possible, come. If it is not, take the 70% possibility of getting cured, 100% cure. 70% of the cases will be cured. This is good. Still good. Try it in your country. If it fails, then come. Thank you for giving these comments to us. Thank you.
Really appreciate you. God bless you. Thank you so much.